Well, guys, I just wanted to say, really thank you for all that you've done, and just thinking about, how we all started and what the goals of district were. I think that the great vision of population health, and at that time that we started, it was a term that was out there, but I think we all fully embraced it, as much as realizing that is such a goal of the local PPS work, and then the overall statewide work, and you guys are such contributors. We made incredible strides. So it's a really good time to reflect back on it, and the fact that you're even still, that you're still meeting, and I think just says a lot about the vision that you guys have. So I wanted to thank you for that. And it's right when we keep trying to, how do we connect everything, the data that we have and all these different formats and all these different sources. We've obviously had all those curveball challenges of cyber attacks, and therefore the kind of all the security pieces, and then but I think we like true, being New York tough, to appropriate a phrase, we found ways to try to get around that, and again do the best we could around how do you take the data that you have access to, make the best use of it, and just keep on going forward. So it wasn't easy. We know that, and it's sorry that there's all this, with all due respect to my colleagues over in DOS, we understand the privacy piece, but we're all trying to just get that stuff done too. And I think that we've made strides there, just knowing what all the our limitations are. So I just really, and then I think the culmination is really just how you all responded to your partners in this COVID crisis, where we all of a sudden had found ourselves, our communities in crisis, people needing real resources, but providers being in crisis themselves personally, as well as but how to get help to people, and what you did around getting equipment out to your community-based partners around how to do telework, telehealth, providing policies, just providing them the support around all the emerging regs on telehealth, and all the rest. So again, thank you. And I really think that is the perfect culmination to show how your roles have evolved, and what pillars you have become, in the communities that you serve. And hopefully, there'll be another shot at this in some way or some form in the future. Now that the election is over, we have a friendlier, administration. Still an administration with facing a lot of challenges, as we all know, but hopefully that door is a heck of a lot more open than it has been for the last several months. So, but I really wanted to just say thank you guys, and it's been a real pleasure to work with you. So keep it up.
Yeah, I want to say thank you for everything that you've done for all the PPSs too, and hope you enjoy your retirement. I think that's wonderful that you're able to do that. You're probably about 9 months late on that, though.
Likewise, Peggy, thank you for your leadership and all of the work that you've done on behalf of the State Association. Thank you very much.
And sure, absolutely. Thank you, guys.
Thank you, Peggy. Enjoy your retirement, and thank you for your leadership.
Thanks, Sonny. You're a great group, so keep on supporting each other. Again, these are those collaborative groups that you want to just stay in touch with, and keep touching base with, keep yourselves, get that feedback, keep on track, bounce things off of. It's a great support group.
Great. Thank you.
Sure. So with that, I'm going to sign off. 'Cause I still have to wrap up my stuff.
Sure.
Peggy.
Well, thank you. Stay warm and be well.
Okay. Thanks, guys. Take
Thank
care.
you.
Bye.
Take care.
Bye.
Thank you.
So from the group, do we have any further questions for the Security Bureau as well as the district team?
So I have a question kind of, and I have a feeling I know that the answer is going to be, I don't know, but I'm going to ask it anyway. So just based on Peggy's comment that hopefully there will be other options in the future with a friendlier administration with New York State, is there any plans to try to work with the federal government on either the previously submitted application for District 2 or a different one?
I'm not entirely too sure. I know that we're trying to make progress with trying to have another submission of a waiver amendment, but in terms of specifics or any of that, unfortunately, I don't know.
Okay, thank you.
I can give a little bit of feedback on that. I don't have much more detail. I don't have any more detail than that. But from the Haney's perspective, we are having those conversations. We recognize that the first hurdle, or the most important hurdle right now, is simply the renewal of the waiver, right? The current existing 1115 waiver, which facilitates everything from managed care in the Medicaid environment to, you know, any number of things, that expires in March. And the number one priority is simply getting that piece renewed. So I think that speaks to what was just said, that the renewal is the key right now, and that there are people who are thinking, what's the next step, and what might the next step look like in this context, given that there's a gap. It obviously wouldn't be a District 2.0, but what kind of things might be included in a, you know, an innovation or reform type amendment going forward, but that's likely a separate and distinct process from the renewal of the 1115 waiver as a whole. So just, you know, nothing really specific other than those conversations are being had.
Appreciate that information. Thank you.
Thank you, Evan. Anybody have other related questions for other initiatives and or for the Security Bureau or Department of Health representative? Not at once. Okay, so thank you, Carrie and Michelle, for your presentation. So I think the group will be getting your PowerPoint after this meeting, along with the meeting minutes, and they will submit their questions to the mailbox. All right. So we will be moving on to the third special topic. So for here, we wanted to spend some time here to share with the group that the survey results, and we saw that they are participants from Haney's, Greater New York, and also the HIE representative today. And thank you all for taking some time joining today's discussion. So while we are sharing the results, feel free to jump in if you have any feedback, and we will discuss in a little bit more length in terms of responses and some thoughts that the group has. So Luann, could you please make me a presenter to share my screen?
You can just go ahead and share. Just hit your share screen. I unshared mine.
Sure, thank you.
Sure.
Okay. Can everybody see my screen right now with a dashboard?
Yep.
Okay, great. So in the survey, we included 9 questions. So far, we have 11 responses, and this is a quick summary of the current responses. From first question, we have listed out what are the benefits that the participant feel from this group. As you could see, there are top 4 highlighted responses here. Number 1 is to get Department of Health updates as well as communications. The second one, which is the same highlight and percentage from the group, is that they feel that connections with the PPS or similar or alike organization, that is one of the benefits that's the group give us feedback. The third one is to get healthcare information technologies and updates. The fourth one is to connect with nice and shiny. Let me pause here to get some feedback and also thoughts from the group before we move on to the next question.
Do you have what the other was?
Right now, I did not see any details in terms of the other showing up in the dashboard. Should we move on to the next question? Okay. We also asked again about the preferred meeting frequency. Right now, we're on a bi-monthly cycle, and this is still preferred from the current responses that we get so far. So bi-monthly first, and some people think that maybe we could move on to a quarterly schedule as well. Okay. Any thoughts, feedback? All right. The third one is the preferred meeting format for the future. We have been doing the Zoom style meeting because of the pandemic. The feedback for the same similar Zoom style is preferred from the 11 responses that we get so far. Couple people said in person. When we are able to meet safely in person, that is still some of the ways that the group feel that we should also get together, because there are some benefit that when you don't meet in person that you're not able to get that from. All right, so move on to the fourth question. So we also asked the group, should the group continue post-district? So we have all 11 responses respond to this particular question. Majority of the respondents feel that the group should continue. There are some people who had specified others, which we will continue to aggregate the data. So if your organization has not responded to the survey, please take a moment to complete the survey, and we will continue to aggregate the data and provide the feedback to the group. Any feedback from the participant today? All right. Move on to the next question. So the format of this group right now, we have the larger group meeting like today, which everybody joins. But before the group meets, we also have a planning committee. So we wanted to see if there are other people who's not currently in the planning committee is interested in joining the committee. So in the planning committee, we review the meeting agenda before the larger group, and the frequency is the same bi-monthly as the larger group meeting. So from this chart, some of the people are interested in, and they are not currently part of the planning committee. Any thoughts or feedback? Okay. Let's move on to the topic that people give us feedback on. So for here, we have listed 4 major topics, which I will ask Luann to sort of discuss a little bit in depth about each category. But before I asked Luann to speak to the details of the category, you could see that there are 2 topics that we get from the group that people are interested in. One is for promising practices as it relates to technology use cases. The other one, which is also very interested from the feedback, is the universal consent. Luann, could you talk a little bit about these 2 categories? I know that there are some thoughts that we want the group to think and discuss about.
So there was, and hopefully will be, some work efforts statewide around a universal or one consent form for patient data to be able to be exchanged a little more freely. I know that there is discussions going on around an opt-out type of consent so that everyone would be included, and if you didn't want to, you would have to opt out. You'd have to sign the consent that said, don't share my data. That is around the majority of the healthcare medical data. Certainly the substance use, behavioral health, mental health would still be an opt-in consent, as the sensitivity of that information is recognized by many as being something people need to be agreeing to share before we share it with them. I know both at the state level and some other groups have been working on some thoughts around this, but with the COVID, my understanding was it's kind of gone to the back burner just because of distractions with all that the state has had to do. As well, around the promising practices, I think because of COVID, there's been a lot of practices that have developed. And again, the telehealth definitely being a big one, but more importantly too, the social determinants of health and some of those care coordination needs that have really come to the forefront of the needs of the population at large in order to provide care in this new environment where we don't always have the opportunity to have somebody right in front of us in person. So I think too, that might be another area that people were referring to as promising practices. There certainly is always the value-based payment discussions, and moving forward, it certainly is something I think in everybody's forefront of their minds, given the COVID and the challenges with everybody trying to meet their quality metrics during this year, and trying to understand how value-based contracting can move forward given our current environment. I know through some of the NCQA initiatives with PCMH recognition, people actually couldn't meet their contracts because some of them just didn't even meet patient numbers. So it has been a challenge, and it'll be interesting to see what goes on for the next year. So that's just, again, some high level anecdotal information about some of those topics. I'm sure there's lots of more details that people could share or potentially share for future discussions if we felt this was of value.
Thank you so much, Luann. So questions for the group. For the category that we have listed, is there anything that we didn't list it here, but the group feel that we should also put a focus on there? All right, I'll take.
Yep. Well, hey, it's Bob. What about telehealth, teleconnectivity, telehealth, I mean, seems like it's going to be evolving. Not the technology, but the usage and the use cases around that. Is that something that this group would have any interest in?
I mean, I think, sorry, go ahead.
Rebecca, I think that's an echo.
Oh, okay. Well, then I guess I will go ahead. So I think that telehealth is definitely something that would be interesting to kind of pull out of the promising practices, to have it be its own standalone, because you're right. I think, you know, through the COVID time frame, it's definitely kind of burst out onto the scene, and I think it's only going to expand more beyond that. It'd be interesting to hear not only what each other are doing in your regions, but also trying to keep up on what's going to be happening with the regulations.
Right. Just keeping those two things aligned could be tricky.
Evan, sorry to put you on the spot. Do you, from your organization or perspective, are there any initiatives that's happening and in line with telehealth that you could share with the group here?
I'm not sure about any specific initiatives. I do know that the numbers associated with sort of the change in the use of telehealth over the last 9 months has been jaw-dropping, right? You know, just the sheer volume of visits is a number that I think 10 months ago nobody would have imagined we could even accomplish, much less have it become the norm in so many settings, right? I personally had several doctor's appointments conducted virtually in the last 9 months that would have never happened that way before. So as far as a specific initiative, I'm not familiar with anything. I do know that Haney's is very interested in making sure that the regulations keep up and that we don't take a step backwards once the pandemic eases. That would be extraordinarily unfortunate, because there are, I think, not just in telehealth, right? There's a lot of areas where we've had to rethink how we do business, how we collect data, how we analyze data, what's important. Social determinants are playing a bigger factor. Disparities in outcomes are something that is top of mind now that wasn't, well, it was top of mind. Interestingly, it was top of mind in the district world well before COVID hit, but now all of a sudden everybody's looking at it, right? So I think Haney's we have been looking at ways that we can use new data sources, looking at developing use cases for different data sets. I think particularly around social determinants of health and health equity. Those are areas that we are actively looking at, trying to put something together. We don't have anything solid yet, but we've had conversations with some some of the data companies out there, with some of the social networking providers. We're having those conversations, and we're very interested in trying to put something together to sort of make a use case for different data sets. I made a note. I would really be interested in trying to find out if there's a way that a broader network of organizations can make a data sponsorship argument that would be something that would be supported. So putting something like that together is something that Haney's is interested in doing. So I'm happy to have that conversation. Tom Halsey, who's also sometimes part of this group, is working with Haney's, myself, and some other folks in that regard. We've had conversations with NowPow, we've had conversations with Unite Us, and would be very interested in trying to find ways that data can be used to facilitate the type of change that needs to happen. So I don't know if that's helpful or if it answers your question, but that's sort of the state of where we're at.
Yeah, thank you. That is very helpful. I think the group, I think we put a very broad category of promising practices, but based on the discussion today, I have already heard several subcategories which we could expand and also collaborate with organizations like Haney's or Greater New York, who had representatives here today, and also the HIEs that I think the group is very happy and also willing to learn more in terms of these initiatives. Anybody who had any thoughts about this area?
Yeah, hi, Annie. It's John from Greater New York. I just wanted to quickly point out that at some point in the future, we can revisit having Zainab, the member of our team who focuses on telehealth, possibly coming to discuss some of the telehealth regs. She's also one of our leads on a lot of our COVID response right now, so that probably wouldn't be able to happen for, a month or two, but we can definitely revisit that talk. We do have some internal work groups on the topic, and would be happy to share whatever we have.
Thank you. Any other thoughts from the group here? The universal consent piece, that is also very interesting to a lot of the organizations here. I know that there are some participants here today from the Health HIE group. I don't know if anybody has some feedback for the group, or you could share some of the initiatives that your organization is working on.
So, I mean, I can tell you that at Care Compass Network, we're starting to look at a regional community consent. We've just recently, like this year, we've kind of gotten buy-in from the organizations within our region, our partner organizations, that this is something that we wanted to move forward with, and have kind of put the standards or guidelines for how it would end up happening into policy. And then within, like over the next year, we'll probably start looking at some of those details. But, you know, definitely very, very interested in hearing if any other regions are looking to do any of that and how they're doing that.
Thank you, Rebecca. Any other feedback in terms of the universal consent topic? All right, let's move on to the next two questions. So far, we have 4 responses out of the 7. Give us feedback in terms of the usefulness of this group. As you could see, we have a 5-star rating right now. The group is still getting responses, but this is the feedback that we have been getting so far. And I do want to thank everybody taking the time to join us. And we look forward to engage external stakeholders and to bring more topics that are interested and current with the organization that's participate with us. A brief moment before we move on to the next question. Any feedback? No? Okay. So we also asked the questions to, can everybody see my screen?
It jumped to my screen, Anya. Try again.
Okay, let me try again. Okay, great. So we asked the participant what are their organization plan in terms of the population that they serve. So this group is originated from Medicaid redesign projects. So we have some feedback from the responses that people are looking into other areas such as Medicare and also some commercial payers. So that is one of the response that we get here. And just wanted to pause to see if there are some feedback from the group. All right, there is none. So the other feedback that we get also confirming the first responses. So there are multiple organizations that are looking to take an initiative or the project that we did with the Medicaid population and expand that and beyond. Okay. Any thoughts here? No? Okay. So let's move on to the last question from the survey. So our last question is asking about what are their organization plans post-distrib. So some of the feedback that we get is the organization is still finalizing their strategic plans, and areas like the specific organizational structure is still being formed right now and still waiting to be fully determined. And also there are a lot of efforts going on in terms of network formation, as well as the support in the local community. And for this particular responses, we have 4 people that had responded to the answer. Anybody has feedback on this particular question? All right. So one last check before we move on to the next topic in our agenda item. Okay, thank you everybody for the time to review the responses with us. So still strongly encourage anybody who had received the invite but has not completed the survey, please take some time and complete the survey, give us the group feedback to form our future directions. Thank you. Okay. So our next topic is subgroup update. But because of the snowstorm, I think the representative from Nice and Shiny was not able to give an update today. So we will move on to the topic number 5 for an open discussion and also a VBP initiatives that's going on in your organization. Any takers to start?
This is Bob. I can give a quick update on maybe some post-distrib activities. That's all right. So, I mean, clearly the organization's working now to the end of the year to technically clean up the PPS contracting obligations, data, technology, things like that. Coincident to that, though, we have a program called STACY, which is Systems Transformation and Community Improvement, Continuous Improvement. And we are focusing on 3 domains as primary areas of investment going forward. And they are maternal child health, behavioral health, and social determinants of health. And we are working with our partners in the region to develop a set of potential initiatives that we can co-develop and co-deploy in our 13 county region, hoping to build out right? More robust networks to support those areas. As we do that, the whole organization will then start to pivot into support around those domains. Additionally, we also have Flips is also I guess the owner of a health home, and we are continuing to invest, expand, and build out the capabilities in that care management organization.
Thank you, Bob. Anybody who also wanted to share some of the updates within your organization from the group? Okay.
This is Katie from NYU. I don't have an update to share, but I would like to just make a pitch for maybe the next meeting, if folks wanted to talk about some of the work that we've had to do for COVID and how that is sustainable through some of the programs that we've worked on. We've certainly been laser focused, as I know all of you have been, and there's been a lot that we've put in place that I think will continue to change the way that we work moving forward. So I think it would be interesting to talk about some of that at a future meeting.
Sure. Thank you, Kate. This is very helpful. Any other feedback? You can also send a chat.
The chat box has been quiet.
Yeah. Okay. Thanks for checking, Luann. All right. Well, if there is no other feedback, this is the agenda item that we prepare for everybody for today's meeting. We hear a lot of good thoughts, and thank you for the feedback and also potential topics for us to refine our future directions. And some of the topic, which is for our next meeting to incorporate on. And our planning committee has some thoughts in terms of the next topic and or potential presentations. Thank you, John, for give us some suggestions about the telehealth. If there is any topics that we didn't get a chance to talk about and you wanted to share your thoughts with us, please do feel free to reach out to myself and also Luann. We're happy to speak with you and also set up a separate phone call to discuss about potential topics, or if you have presentations within your organization, within your region, we're very happy to have you to present in our next meeting. Any other thoughts before we conclude for today's meeting?
This is Katie again from NYU. I had one other thought.
Sure.
I know that our organization has also been vigilant around security. There's been a lot of cybersecurity threat that we've all heard about, not necessarily, in New York State, but elsewhere. I think that's also an important topic for us to think about touching on.
Thank you, Katie. Yeah, that is definitely a very, very important topic. Well, thank you again, everybody, for taking time to join today's meeting. Well, stay warm and stay well. We'll see you next time.
Thank you.
Thank you.
Thank you.
And happy holiday.
Happy holidays.
Hi, everyone. Thank
Bye.
you, Luann.
Take care, everyone.